name is Corinne.
My name is Melinda.
I'm Lynden.
And I'm Kelli, and we are all nursing students at Davenport who are going to be explaining oral medications today. So an oral medication is a medication that is swallowed and then absorbed through the stomach or small intestine. Some examples are capsules, tablets, time-release capsules which are slowly released throughout the body. Tablets are enteric-coated drugs that are acid insoluble and to keep them from dissolving in the stomach and instead waiting until the small intestine. There's elixirs, extracts, fluid extracts, syrup, powder, which is finely grounded drug that is mixed with liquid before digesting, and then solutions, which drugs are dissolved in liquid carriers and suspensions.
When administering oral medications, some supplies you're going to need are a styrofoam cup, disposable medication cups for the tablets, and then for liquids. Liquids has the different measurements so you can measure it. Your medications, and also a drug safety guide to teach your patient on. Some special populations to pay attention to are children and older adults. Specifically for children, normally they cannot swallow tablets, so their medications come in liquids, sweetened and also flavored so that it tastes good. Also, be aware of choking and aspiration. You want to watch them as they do it so that it doesn't become a problem later. Also, make sure you do not use kitchen utensils or sippy cups. This will make it so that they don't want to eat their cereal or breakfasts, and also they don't want to drink their milk from their sippy cup if it's like a not desirable taste. Also, for children, as a nurse, it's important to ask the parents what techniques work best for their children. In regards to older adults, it's important to address swallowing difficulties. Maybe crushing tablets or mixing them in with pudding or applesauce will make it so that that patient can swallow the tablet. Also, accommodate for slower reflexes and reasoning ability. It's important to make sure you have enough time to explain the medication and why you're giving it to them. Lastly, stay with the patient until they have swallowed or taken all of the medication. Otherwise, many patients will put it in their mouth and spit it out when you leave, or just never take it if it's at the bedside.
Before I enter the patient's room, I'm going to gather my supplies and the 2 medications that I'm administering. This is where I'll do my first check of the 6 rights. I'm also going to do my first check of the 6 rights on this drug. With liquid medications, you have to be sure that the liquid is below the line at eye level. Okay, it is. Now that I have my supplies gathered, I'm going to go to the patient's room.
Knock upon entering the room. Ensure patient privacy. Introduce yourself and explain the procedure. Perform hand hygiene. Perform third MAR check at the bedside before administration.
Can you tell me your first and last name and your birthday?
Jane Doe, 3778.
Okay, great. Okay, so we're going to start with the pill first. Here's some water. And here's the liquid and some more water. Did those go down okay? Are you feeling all right?
Yes.
Okay, great.
Always be sure to evaluate and implement the 5 patient rights, which are the right patient, the right dose, the right drug, the right route, and the right time. Another right to consider is the right of documentation. Always check the 2 patient identifiers before administering any medications. Okay, as we conclude, always be sure to check your patient's medication history as well as any use of CAM drugs or complementary alternative medicines. These may cause adverse reactions. So it's important to keep in mind the specific populations that may need special consideration when giving medications. These populations would be children or older adults. Next, the patient's head of bed needs to be greater than 45 degrees to prevent aspiration during administration. All these techniques are crucial for reducing medication errors. Thank you guys for watching.